What's the difference between physical therapy and Pilates, and how do I know which one is right for me? That's a question I get all the time. My name is Angela Marciano McCarthy, and I'm a physical therapist and Pilates teacher based in Beverly, Massachusetts. I offer private in-person physical therapy sessions and private Pilates sessions, both in person and online, as well as live online Pilates classes, and coming soon, some recorded Pilates content. So just today I was talking to someone again about how do you know which one is right for you? And it depends on a few different things. If your pain or limitations are fairly stable, you know how they behave, or if it's sort of like chronic nagging aches and pains, if you've been through physical therapy, good physical therapy, and you're better, insurance coverage, a lot of times you get, 60 to 70% better, but you're not quite back to doing all of the things. Pilates can be a really great fit. After pregnancy and postpartum, if it's fairly uncomplicated and you're just feeling a little disconnected from your body, not as strong as you'd like to be, maybe you feel a little off or out of balance, Pilates, again, can take care of a lot of that. You're always going to get more specific guidance for your own body in a private Pilates session. Group classes are great and they can be enough. But if there's something that you're struggling with, it's hard in a group class because of that group dynamic. You're not going to get as specific languaging or modification or hands-on like you would in a one-on-one session. That doesn't mean you need hundreds of private sessions, sometimes just a few to supplement your classes as you get started, and then problem solving along the way. If your pain is a little bit more unpredictable, you're not really sure what's going on, you don't know what makes it better, you don't know what makes it worse, you don't really understand things you can do to help yourself when you're in trouble, things you can do to stay out of pain. If your pain is pretty severe, chronic or unexplained pain, you've had imaging, you've had PT, you've gone for massages, maybe injections, medications, that's definitely a time you want to start with physical therapy. Postpartum moms, if you're having issues with incontinence or prolapse or pelvic pain or pelvic girdle pain, definitely great to start with PT. In my Pilates or in my PT sessions, we'll start to integrate some corrective exercises and Pilates-based work. And I always start with breath work, whether it's in PT or Pilates, because your core is your foundation for everything. And breath work is really the linchpin to making everything work a little more effectively and understanding that. So hopefully I answered your questions. If you have more questions, drop them in the comments below and I will try to answer them. Have a great day. Bye.